Okay, start.
Okay. Okay. Hello, how are you?
I'm fine, thank you.
Okay. So how is Linda doing today?
Well, doctor, I think so. Her, condition is getting worse. I don't know what to do.
Okay, because yesterday when I saw Linda, I had advised some medications and I had advised a follow-up. But I noticed that you have come early just today. What happened?
Well, I think so. Her condition is getting worse, doctor.
Okay, in what way did what new thing happened? She is not responding to medications?
Oh, no, doctor. You know what? She's having this barking cough. She's having fever also, and she's sneezing. And I think so that her condition is getting worse. I don't know, but it's getting worse. She's coughing more.
Uh, okay, okay. May I know your name? May I know your good name?
My name is Linda.
Okay.
No, my name is
Uh,
Alexander.
okay, okay. So Zainab, I would actually advise you that I know as a mother, you will be very much worried about your daughter's symptoms, Linda's symptoms, but don't be worried because it will take some time and it will get better. Okay. And also, maybe it's because Linda is quite young, so that's why you are very much worried that she might not be able to express it. Because, this steroid treatment that we started yesterday for Linda, it will respond, and with it, Linda's cough and this croup will get better. Okay, and there will be some side effects of steroid, but don't be worried about it because if it is given in a proper dose, it will not affect her. Side by side, you can continue good diet for Linda. You can give her more fluids. You can get her good rest. I hope you are understanding me, Zainab.
Well, doctor, I just wanted to know the possible side effects of using steroids.
Okay. You see, some of the possible side effects is that it might, that everyone has an immune system which is preventing them from having further infections. Okay. So one side effect of steroid is that it can cause the lowering of this immune system. If the barrier gets down, they are more prone to infections. But if at the same time you are taking good care of Linda, uh, hopefully there will be nothing like that, and there is a chance that they might get some other infection. So you will just have to take care extra for them, like you will take care that they are not exposed to other environmental hazards, they are not going out, they are getting proper rest, you are giving Linda proper rest. And also, I want to assure you that this steroids, it will really help in the group that Linda is having it, because basically it's a viral thing. And if we give any other treatment, it's basically like antibiotic. And for this viral, the best is steroids because it will calm the inflammation and it will make her feel better.
Doctor, I'm very much concerned about the side effects. They are very dangerous.
Yes, but it, you have to actually, Zainab, you have to see what is more beneficial. Just worrying about the side effects or trying to treat her group, because, if we are not giving timely steroids in a proper dose, then the group might not be alleviated easily. It might increase and it might cause more problems. And it might lead to deterioration in her health. So because don't worry, I am giving you the steroids that I have prescribed for Linda in a proper dose, and I have tapered it also as prescribed in a few days. So it will not affect her. The chances are very less.
Well, doctor, I think so. You should give Linda some antibiotic because that will be, because I believe that it will eliminate the infection and help her to get better, doctor.
Yes, but you see, luckily for Linda, At the moment, because it's a mild croup only, it's no other symptoms are appearing like that, which is pointing towards any bacterial infection. So I'll try to avoid giving antibiotic to her. Okay. And I will let her have her the recovery cycle of the croup itself, which is sometimes self-limiting as well, plus with the help of steroids, because basically croup is like a viral infection. And
Okay,
also I
doctor.
want yeah, and also I want to tell you, Zainab, that don't worry, because the way you have come, it indicates that you are worried. So I will review with you Linda's case in the next 24 hours. And in between, if anything arises, you can also come early.
Okay, doctor, thank you.
Welcome.
Okay, it was around 5 minutes and 30 seconds. Secondly, there were some grammatical mistakes. Third, there were no IPS, like you were not friendly, there were no empathic sentences. Just in the end, you just told one. And while you were offering her to review, again, that sentence was grammatically wrong. And there was no introduction. Okay, so no
Okay.
introduction, and and you were jumping from one task to another task. You was not waiting for me because I am having the questions. I will ask you the question. It's not like that for the 5 minutes and 30 seconds, it's only you who will keep talking. No, you have to stop.
Okay.
Okay, so rest of the
Okay.
mistakes I will
Okay.
tell later. If anyone else want to do, just let me know. Anyone else? Or I will just tell the mistakes and everything, and then I will just end this meeting. But there are other participants also. So if anyone wants to do, just let me know.
So you will tell our my mistakes, right?
Yes, but these are the
Yeah.
major mistakes. There were some grammatical mistakes. Okay, and you were jumping. There was no empathy. There was no proper introduction. Okay, and you were jumping from one task to another task. Okay, and you were
Okay,
not.
Dr. Hina, I wanted to ask, yeah, I wanted to ask one thing, cameo. Can you do the cameo version of it? Yani, like as you are, like I am Linda's mother, and how you will talk to me? Can you show us in this recording?
I will tell that also. I will do that also. And while I teach the students, I do that. First, I let them perform, and in the end, I just do it myself to tell how to,
Oh,
speak and converse and what empathic sentences. And one more major
oh,
mistake that you was doing was you were repeating your sentences. You were giving the same information again and again. Okay, so Fatima, you want to do the card?
But I am the new one. I have no idea how to do.
I think so. You might have got some idea from Samiha. Okay, if anyone else want to do,
Ma'am, now my voice is clear to you.
yes. So you want to start?
I'm saying, yeah, but ma'am, I am new one, beginning, so no proper idea how to do.
Okay, no issues. You start, and then I will let you know.
Okay. Should be I patient mother or a doctor?
You will be the doctor. The patient card is for me.
Okay, ma'am.
If anyone else want to do, just let me know.
Ma'am, should I start?
Yes, start.
Ma'am, in the start, one question. Patient will take start or doctor will take start?
And the doctor will take the start.
Okay, ma'am. Thank you. what's your good name mean in as a card? What should I call the other person? Should I
You can
ask
call
in the start of name?
you can call me Alexander if you're just not going to start. And before you can ask my name and you can call me Alexander or anything.
Ma'am, let's suppose here is given Linda's mother, not name. So what should we call them? Or
I just
we
told
should
you that
ask
you can
the
call me
name.
Alexander. If
Acha,
you need some time,
Alexander.
yeah.
Okay. Yes, ma'am. Give me 1 minute so that I should repeat. Hmm? Okay.
Anyone else want to do the card? I think so Fatma just got busy. Shaila has also joined. So do you want to do the card, Shaila?
No, ma'am, I don't have it.
Fatma, are you there?
Yes, ma'am. I'm back.
Shall we start, Fatma?
Yes, ma'am.
Okay, start, please.
Hello, Linda. I am Linda's doctor. Linda is presently suffering from croup and sneeze and fever. Are you right? Am I right?
Yes, doctor.
Okay. Thank you. What's about the present health of Linda? Is she fine?
No, doctor, her condition is the same, and I think so it's worsening. That is why I just brought her here.
Yesterday, Linda was diagnosed with mild croup, and you are saying that her condition is getting worse. But now, what are the conditions of symptoms of Linda presenting?
It's the same cough, fever, and sneezing, and it's kind of a barking cough.
Okay, okay, ma'am, I understand your concern, but I would like to say that I will refer him towards steroid treatment. Uh, mm, Actually, I think actually Linda is suffering from viral infection, and her treatment is in steroid treatment is best because and it has some side effects, possible side effects of steroid treatment that will be suppression of immune system and predisposition to infection. So there is no need to worry. Inshallah, with the passage of time, Linda will be better.
Well, doctor, I'm very much concerned about the side effects. So could you please tell me the side effects and, what are those?
Side effects include suppression of the immune system, mean immune system will not work for some time properly, and it will affect the infection, and infection will be controlled with the steroid treatment.
Okay, and well, doctor, I'm very much concerned. Like, what will happen to Linda? There are very serious side effects. I'm very much worried about the side effects, doctor.
I understand your concern, ma'am, but there is no need to worry about that, and we cannot go toward antibiotics because cough is a viral infection, and through steroid treatment we can eliminate this infection.
Well, doctor, I think so that antibiotic is good for Linda because I believe that antibiotic would eliminate the infection and might make her health better soon.
Yes, ma'am, your concern is true. I agree with it, but antibiotics are not eliminate the viral infection, and Linda is suffering from viral infection. That's why I am referring him toward steroid treatment.
Uh, okay, doctor, as you say, doctor.
Okay, I am prescribing him steroid treatment, and requested you to visit again after 24 hours. And if you feel that there is something serious and worsening in condition, you can come and visit again. If you have any concern, you can ask me.
No, doctor, no concerns now.
Okay, thank you, ma'am. But if you have any question and during that 24 hours, you can ask and you can visit at any time. Thank you.
Thank you, doctor. Okay. Never, when you know my name, then never call me ma'am. Okay. When you're doing the card, be confident. You have to work on your English. Okay. There were some grammatical mistakes. Moreover, you were not sounding confident. You were very nervous. If it was your first time, it was good, but you have to work on your English and how you have to talk confidently. Apart from that, again, you were just jumping from one task to another task. There was no relationship building. There was no empathic sentences. There was no proper introduction. No proper conclusion was there. Okay, and the sentences, you were just jumping from one task to another task just to finish this. But that's not your, it's basically the exam of your English. So you have, and it's very important for you to understand the scenario and then proceed further. Okay, so I would advise you to, um, talk English and just sit in front of the mirror and keep on talking in English. You will develop confidence. The nervousness in your voice or the shaky voice will also diminish with time. Okay. So anyone else want to do this, perform this card? Anyone?
Yeah, ma'am, I want to perform.
Okay. Do you need time or shall we start?
Yeah, ma'am, we can start.
Okay, then start. And yeah, Fatma, your time was around 3 minutes, 40 seconds.
No, ma'am, I'm Saman.
No, no, I'm talking about Fatma.
Okay, ma'am.
Okay,
Okay. Okay, someone
Okay,
start.
ma'am.
okay. Hi, Alexander. Ma'am, what's your name, Alexander?
Yes, you can call me Alexander.
Okay. Hi, Alexander. Nice to meet you again. So, can you please tell me how can I help you?
Well, doctor, again, I'm here for Linda. Yesterday, she was diagnosed as mild crop, and you just recommended me to go home and observe her and the symptom relief. But I believe that her condition is getting worse. She's, the curve, she's having this barking curve, fever, and she's sneezing a lot. That is why I'm here again.
Yeah, I know it must be a very painful for you being a mother. So it's an infection and it takes time. Yesterday you came and I gave her some like painkillers like for symptom relief. So it will take time to recover. So don't need to worry. I know being a mother, you are worried, but it will take time for the symptoms to relieve.
Okay, doctor.
So yeah, I will suggest some steroid treatment, and her condition will be fine after the steroid treatment.
But doctor, you
Uh,
just said that it will take time to get her symptoms relieved. So why you're prescribing steroids?
yeah, even after steroid, it will take some time for the symptoms to relieve.
Okay, doctor. I've heard a lot of, lot about the steroid infection, side effects. Do you mind telling me
Yeah.
what are those?
Yeah, like in everybody there is an immune system which protect us from the disease and from the infection. So like it can be a side effect of steroid, like it can suppress the immune system. So like if the immune system is suppressed, then we are more prone to infection. So like you have to, being a mother, you have to take care. You have to take more care. You have to take care to prevent the infection.
Well, doctor, how I will take care to prevent the infection? And I'm very much
Yeah,
concerned about these possible side effects.
you have to you have to give her plenty of fluid, and you have to give her proper rest.
Well, doctor, I'm very much concerned about the side effects. They are
No,
very dangerous.
you don't need to worry. Uh, these are not like, uh, ma'am, I am unable to do.
Okay, well, doctor, I think you should prescribe antibiotic for Linda because I think it will eliminate the infection and help her to get better, doctor.
Yeah, but like antibiotics are, this is the viral infection. So antibiotic will not work properly for the viral infection. Antibiotics are specifically for the bacterial infection. So like in this case, there is no use of prescribing antibiotics. So that's why I'm saying it's better to move towards the steroids, and she will cure better with steroids.
Okay, doctor.
And yeah, and one more thing, like if you notice that her condition is getting worse, so like you can come early, but I would like to see the Linda in next 24 hours. But if the
Uh,
condition worse, then you can visit early.
okay, doctor. Sure, doctor.
Okay, thank you.
Thank you. Okay, the major mistake that you did, again, no proper conclusion, no proper introduction. And the major mistake was you were interrupting the patient when I said that how I will prevent from infection. You have to never
Yeah,
interrupt the patient. You have to listen to the patient. Okay, never ever
okay,
interrupt the
ma'am.
patient, no matter what happens, no matter how many times the patient is asking anything, you will not interrupt. Moreover, do not put yourself in difficult situation. Like, you will just prevent the infection. I gave her this, and you are just again here. The symptoms, because you were so okay yesterday, you said okay, it's a viral infection, it will take 4 to 5 days, but okay, fine, I will start the steroid infection. You yourself put your you yourself was in a put yourself in a difficult situation, that I will ask a counter question, that okay, fine, when you're saying that it will heal in few days, the condition will recover in few days, then why you're prescribing me steroid?
Hmm.
And you, when I
Yeah,
asked you this
ma'am.
question, you were blank. You said okay, no, we will
Yeah,
give steroids. So uh,
yeah,
again, if you are not very fluent with the language, then don't put yourself in in danger. Don't make these kind of questions, because the examiner will ask you the counter questions. Okay, fine, then why you are giving me steroids? As you
yeah.
told me that okay, fine, it's a viral infection. No, then you should have the answer to justify that why I am giving steroids. Okay, now everyone, I will just give a quick overview. Now you have listened to three people. They have done this card. So main is the introduction. Your introduction should be very good. Okay, here your introduction. No one gave a proper introduction. Even I just came yesterday, and I'm here again. So you will introduce yourself very nicely. You will say, okay, hello, Mr. Alexander, or hello, Miss Alexander. Okay, nice to see you again. As you already know, I'm Dr. Hina Khan, one of the treating physician in this suburban clinic. So what's brought you here today? How's Linda doing? You can just ask this. Okay, how's Linda's condition, or how's Linda doing so far? Then I also know doctor's condition. Oh, okay. So, okay, Miss Alexander. So you visited me yesterday because Linda was having this barking cough, fever, and sneezing, and I diagnosed her as a case of mild croup, and I asked you to go home and observe her. Okay, and if the symptoms worsen, you can come back and visit me. Am I right? But and visit me. Where is the card? Okay. Visit me after how much time diagnosed and okay. So has her symptom worsened as it was yesterday, as it was yesterday before? Yeah, you can ask, okay, how her symptoms are doing now. Did you notice any worsening of symptoms, or has her symptoms worsened? Then I will say, yes, doctor. Her condition, or her condition has deteriorated or whatever. Okay, is then I will say, okay, I understand. Okay, fine, TK. Then again, you can also add an empathic sentence. If this is not the way you're going, for example, if you have not going in this way, you will just come, okay, if I just ask you, okay, Miss Linda, no, sorry, okay, Alexander, how's Linda condition now? Have you noticed any worsening of symptoms? That is why are you here today? Then I will say, yes, doctor, there is a worsening of symptoms. Okay, Miss Linda. So she was diagnosed as the Croup, and you have noticed worsening of symptoms. Am I right? So I'm afraid to inform you. I understand, but now I will start this steroid treatment. How does this sound to you? Because you are giving a suggestion. Then I will say, okay, I have heard more about this. I understand. I appreciate your concern. There are many side effects. The most common side effect is suppression of immune system. Immune system is our body system that prevents our body from getting the infection. So if she will be on steroids, she might be more prone to infection. Am I clear? Then also, I'm very much concerned. I understand your concern and your worries are quite understandable, but we are going to give her steroids for a short period of time. So it will not affect that. Moreover, you can use connectors also. Moreover, with healthy diet, with plenty of food, with plenty of fluids and rest, you can save her from getting infected. Okay. If she is having a healthy lifestyle, then do not worry, she will not catch infection. Okay. And the first one lady who just did the card, she made some grammatical mistakes while advising the patient about the rest. Okay, the sentence, if you put her on rest, you will never put anything on the rest, and she's a human being. You will put her on rest. I will not put her with rest. I would just say, okay, with rest and healthy diet, exercise, or healthy food, she can prevent herself, or you can help in reducing, Linda to get the infection. Then, okay, fine. About the antibiotics. When you just come to antibiotics, I appreciate your concern. I understand your worries. Being a mother, it is difficult for you to see your daughter in pain. But let me inform you that croup is a viral infection, and antibiotic will not be helpful. Antibiotic is usually given in cases of bacterial infection. Viral infection subsides within few days, but as you have seen worsening of the condition, worsening of symptoms in Linda, therefore I'm going to prescribe her steroids. And then again, if I will ask that, okay, fine, why you are prescribing steroids then when it's a viral infection, then the answer will be, well, according to the research, according to WHO research or NHS research or whatever research you want to say, you can say that steroids is the first line treatment to if there is a worsening of symptoms in a patient with croup, then the steroids is the first line treatment. That is why I'm prescribing her steroids. Yeah, I'm commencing her on steroids. Now you just see that I'm using synonyms, also prescribing, commencing, and I'm just not repeating myself. I'm just paraphrasing the sentences. Okay, I'm paraphrasing the whole scenario. I'm not using the same sentences. Okay, fine. Then okay, then you have reassured. Okay, fine. Then is that okay with you? Then I will say, okay, fine, it's okay, yeah, whatever. Then, okay, fine, I'm glad that you have agreed, Miss Alexander. Now, I would like to review Linda in next 24 hours. And so I can see the progress. Yeah, I can check how the treatment is going well. Yeah, how well she's responding to the treatment. Yeah, I will check her progress. Is that okay with you? Can you bring it to her? Can you bring her tomorrow as well? Yeah, after 24 hours, can you visit the hospital? Then I will say, okay, yes, I'm glad that you have agreed. Do you have any further concerns? I will say no. Okay, then what you can do is, if you're sensing that some time is left, then you also can give a leaflet. What you will do, okay, fine, Miss Alexander, here is a leaflet which contains all the information about Croup and how it's managed and what precautions are necessary to be taken while you are having Croup. You can take this home and read it. If you have any further concerns, you can contact. Take care. I wish Linda a speedy recovery. Have a nice day, Miss Alexander. Thank you. Bye. This is the proper signposting. This is a proper closing. And that was the proper introduction. Whether the patient came to you, visited you yesterday, but you have to introduce the patient today as well. You have to introduce yourself. And when all this thing is mentioned, now you will ask, okay, if you're asking, like if again you think that you will be able to do this card in less than 5 minutes, then what you can do is you can ask the patient, okay, fine, take it. Okay, Miss Alexander, this is this. So how's Linda doing? Or you are here for your daughter Linda, am I right? Because she was yesterday. Okay, fine. How's Linda doing? Because never ever the child will be with you. Okay. So what you can do is, in this case, if the patient is telling you all the information about the cough, fever, and sneezing, if that's okay, then okay, it's fine. Then if the patient is not telling you, then you will tell the symptoms, just to utilize your time. Okay, fine. I understand, Ms. Linda. Yesterday, I understand, Alexander. Yesterday, Linda came and she was diagnosed with the mild Croup because she was having barking cough along with fever and sneezing. Am I right? And I just asked you to observe and visit me after a week or so if there is a worsening of symptoms. So, have you noticed any, worsening of her symptoms or a deterioration in her health or something like that? Then you will proceed further. Okay. So this is how you will do this card.